Alrighty, Josh Rubin from East West Healing and Performance. Today I want to talk to you about chronic neck pain. Myself and my wife get emails all the time from people that have chronic neck pain, or people that come to see us with chronic neck pain and no one can figure it out. Well, the body's an integrated unit, so of course you could have a problem with your ankle, a problem with your pelvis, a problem with your sacrum, SI joint, you name it, and you can have neck pain. The problem is, and I'm not trying to dog anyone, a lot of people think I'm trying to be condescending. I just call it like it is. I call it like it is based off my own experiences. So if it seems condescending, I apologize, but I'm telling you my story, so at least appreciate that. People come to see us and they're seeing massage therapists, they're seeing chiropractors, some physical therapists, and they still have neck pain. They're getting a massage, they're getting it stretched. Well, the first thing is, like I've talked about before, a lot of people go by feel without doing assessments. So make sure you get assessed first from the head all the way down to the toes. Have them look at respiration, all the biomechanics and the viscera involved, the fascia, you name it. Vision, hearing, the upper cervical spine, the 5 joints of the shoulder, the spine, the 22 axes in the sacrum, the innominate bones, and you name it. Because if they're not doing that and they're stretching, maybe they're stretching a muscle that's completely elongated, and by massaging it and stretching it, they're making it worse. So make sure you get assessed. Second thing is, if you have chronic neck pain, you can't just look in the neck, right? The typical through fascia and muscles, you know, if your right shoulder has pain, a lot of times you need to look at the opposite hip because of fascial connections and muscles to the lats, thoracolumbar fascia, the glutes, things like that. Same thing, you have a left hip problem and have opposite shoulder problems. Now, it's a lot deeper than this, but I'm just trying to give you some insight to look into. There's 5 joints to the shoulder. You need to assess all those 5 joints. It's not just the glenohumeral joint. It's SC joint, AC joint, glenohumeral joint, scapulothoracic joint, deltoid humeral joint. So there's many things that need to be looked at, and many people overlooking them. Assess the cervical spine, the lumbar spine. Assess the sacrum. Make sure your practitioner is actually looking at all the axes of the sacrum, as well as the 3 of the pubis, as well as the innominate bones, the iliac bones, right? There's many things that could be going on. Or assess the knee and the foot that could be driving everything from the ground up. So that's not the purpose of the video, but those are things that you want to look at as a practitioner or as a client, because if you're suffering, you need to nowadays go in and say, well, you're just looking at my neck. Maybe that's not the problem. I've been seeing you for 8 months and I still have neck pain. And if you're seeing someone for 8 months and you still have pain, you might want to reevaluate if they're really doing their job, or if they know what they're doing, and maybe you got from them what you can. It's time to move on, right? I want to put something else out there. And actually just got this from a client of ours, and people bring it up all the time. They talk about chronic upper trap tightness. They get it assessed, it's actually short. They stretch it, it doesn't lengthen. They get ART, NMT, anything that ends in a T doesn't relieve the pain. They have pain when they rotate their neck. At the same time, if you think about it, you have cranial nerves, right? You have 12 cranial nerves. Now they're saying you have a cranial nerve 0, so we could say 13 cranial nerves. But the bottom line is you have cranial nerves. They exit different parts of the cranium, from the ethmoid to the sphenoid to the temporal bones to the occiput. We're going to talk about cranial nerve 11, the spinal accessory nerve, which innervates your upper trapezius and the sternocleido-occipitomastoid muscle, which is 4 parts. So it innervates that muscle. So for instance, if I look to the right, it's innervating the upper trap and left SCM at this time. It's actually a contralateral nerve innervation, or cranial nerve. Now I'm going to get a little technical here. It's okay, you need to know this stuff. You might want to show your practitioner you're working with, or at least say, well, maybe they're not looking at this, I need to go somewhere else. This nerve actually exits part of the occiput. The occiput is 4 bones. Most people say it's 1 bone. It's actually 4. It's the foramen magnum, the basiocciput, the squamous of the occiput, and the jugular foramen of the occiput. There's 4 parts, and it actually moves in specific movements when you breathe. And that's why you need these movements. They move in all together to actually create a fluid-like rhythm upon respiration to pump the brain, the nerves, the arteries, the cerebral spinal fluid. So I'm going to show you a little picture. Now I'm going to show you a little picture of the jugular foramen here. I don't want to get too technical. You can see it's kind of in red. It's right over here. You can see it's in red. And actually, through that canal between the occiput and the temporal bone, you have different nerves that go through there, right? The jugular foramen, it's part of the occiput. And as I mentioned, you have the spinal accessory nerve 11. You also have cranial nerve 9 and 10, which is the vagus, and the glossopharyngeal, as well as different arteries and veins, jugular artery and vein. The bottom line is, I don't want to get too technical with that and have you look at this picture all day, but the bottom line is the cranial nerve exits through there. So, if you fall on your coccyx through its dural attachments to the ethmoid, you can have cranial problems. If you get hit in the side of the head, right, you could have temporal problems, parietal problems. You could have frontal problems, sphenoid problems, occiput problems. There's 29 bones. It could be an issue anywhere in there. Any of those bones can actually affect the occiput and how the occiput moves when you breathe. Now, if there's a compaction or if the bones aren't moving properly, what's going to happen is that nerve can either get impinged in that space, which is small, or it's not getting milked and kind of nourished. And what can happen is you get a chronic, if it's getting impinged and there's chronic pressure, it's going to overstimulate it and send neurological input, right, in excess to the upper traps in the SCM. And how many people do you know that have tight upper traps and tight SCM? They go to the massage therapist over and over and over again. It doesn't get better. So what I'm proposing is this. What if we actually looked at the cranium, we assessed the different bones of the cranium, whether it's the occiput, the sphenoid, the temporals, parietal, ethmoid, sphenoid, volar, you name it. What we call maybe the vault or the base. If you get someone to assess that, whether they're an osteopath, a craniosacral therapist. At the same time, you need to have someone look at the spine itself, but also the axes in your sacrum and your non-mit bones, because through dural attachments in your spine down to the sacrum, if you fall on your coccyx, you can actually end up with a cranial problem. And it can affect how your spine moves, how your sacrum moves, but also how your occiput moves, which can affect upper trap and SCM problems. So what I'm proposing is this. If you're seeing someone, you're not getting results, if you go in the typical ART, NMT, the typical stretching, exercise, you name it, it's not working, have someone assess your pelvis sacrum, have someone assess each part of the spine, as well as all the different cranial bones. Because if they open that space, now, not even through stretching, we're actually going to start to milk that nerve. We're going to pull away that sympathetic input. We're going to relax those muscles without even stretching it. So, hopefully you've learned something today. It might have been a little bit deep, maybe a little bit confusing, but the bottom line is the body is a functional unit, and everything is connected. And you can even talk about that canal itself actually houses other nerves. It actually houses veins, the jugular vein and the jugular artery, and the jugular glomus, which regulates O2 and CO2 and pH in the body, in the brain. That canal has other nerves going through it, like the glossopharyngeal, the vagus, which regulates digestion, carotid artery and carotid sinus. The glossopharyngeal regulates different muscles in the body, different glands. So there's many things that can happen just from having an impingement there. You can have an impingement there and have severe digestive problems that no one can figure out. And it's just because that nerve is being impinged along with cranial nerve 11 spinal accessory, causing upper trap and SCM problems. So hopefully you've learned something from this video. The goal really is not to overwhelm you, but to have you realize the body's a functional unit, it's connected. And that you need to work with someone that understands this, because otherwise you're going to be wasting your time and energy. So look into it. Find a skilled physical therapist, a skilled, not U.S. trained osteopath, unfortunately, that knows manipulative therapy, or a skilled craniosacral therapist or visceral massage therapist that can work with you and help eliminate this problem without even focusing on that muscle itself. Thanks for tuning in. I'm out of here.